everyone, and welcome back to the Medical Equipment World and Healthcare Get the Scoop, the podcast where we break down durable medical equipment, patient care, and real world solutions for caregivers, families, and healthcare professionals. I'm your host, Tara, your certified medical equipment specialist with CFS Medical Supplies and Equipment, CFS Solutions, and my co host, Silas, is not here today, but we have the great Dr. Sota on today. And so he was on before when we first started our podcast. He was one of our first guests. And so we have him back today, and we're totally excited because he's very busy and he has joined us here today. But I'm going to read a quick disclaimer. The information shared in this podcast is for educational and informational purposes only and is not intended as medical advice. Always consult with your physician and healthcare provider regarding any medical decisions or concerns. Neither the host nor guest assume liability for any actions taken based on content discussed in this episode. And you guys always know I say, and any other episode. So welcome, Doctor.
Thank you very much, Tara. And hello to your audience.
Yes, we're totally excited. I have to tell you, Doctor, we got a lot of downloads for when you did your interview, and it has just grown, and people are still downloading your that episode about sickle cell. So so we were totally excited. So you guys, I know you guys probably missed the last time Doctor was on. So what I'm going to do is I'm going to read his bio really quick here, and then Doctor can kind of just go in and share with us who he is, what he does, and all these great things. And then we're going to be asking questions and talking about his anniversary that is coming up on July 4th. So we're totally excited about this. So today we have guest is Dr. Sota Omoigui. Did I say that right, Doctor?
Omoigui.
Omoigui. Okay,
Yeah.
Thank you, because I would mess up some names.
No problem.
Okay, so he is a board certified anesthesiologist, pain medicine specialist, medical researcher, and medical director of the Division of Inflammation and Pain Medicine in the Los Angeles area pain clinic in Hawthorne, California. He also serves as the CEO of State of the Art Technologies, Inc. Dr. Sota is widely recognized for his research on pain and inflammation. His work proposing the inflammation is the underlying origin of pain has been cited extensively in medical literature and has influenced discussions in pain management around the world. Most recently, Dr. Sota has gained international attention for his work exploring the role of home oxygen therapy in helping prevent and reduce sickle cell crises. His research and recommendations have sparked conversations among healthcare professionals, patient advocates, and policymakers about new approaches to improving the lives of individuals living with sickle cell disease. Today, we're excited to discuss his research, the science behind his work, and what it could mean for patients, caregivers, healthcare providers, and families around the world. So again, welcome to the medical equipment world and healthcare. Get the scoop, Doctor.
Sure. Thank you very much, Tara.
Awesome. Doctor, I know you are busy, and I am just thankful that you took the time out because I know you're preparing for your call on the 4th. And so we'll be definitely sharing that in our bio in his bio in the blog section, you guys. So for any of you out there who wants to jump on the call on July 4th and listen in, it is 9 a.m. Pacific Standard Time. But we will have that information listed so you're able to jump on and listen in, because it's gonna be you, Doctor, and some other physicians as well. Is that correct?
Yes, it's going to be actually a conference to highlight the achievements and the second year anniversary of my discovery.
Mm-hmm.
And the discovery showing that of the right treatment, which is inhalational oxygen, in the right place at home,
Mm-hmm.
at the right time, the golden half hour, they can prevent, reverse, and stop a sickle cell crisis. And using home oxygen either from a cylinder or from a continuous flow oxygen concentrator.
Oh, that is amazing. That is so amazing. What inspired you to organize this second anniversary event, Doctor?
Because we have a WhatsApp platform.
Mm-hmm.
We exceeded capacity of the first one with more than 1,000 members. We had to open the second one. We exceeded the capacity of that one with another 1,000, and we're on that third platform. So we have more than 2,000 members now, and we have hundreds of families implementing my discovery using home oxygen, with some families not having a crisis in more than 1 year since starting home oxygen.
Oh my God, that is amazing. So is that, can you break down for the audience what is the golden half hour discovery? Just kind of explain that in detail for us so they can kind of truly understand what it consists of.
Okay, the whole issue with sickle cell is that during a low oxygen environment, the red blood cell changes shape to a sickle shape, and then it now obstructs the blood vessels and becomes damaged, obstruct the blood vessels, and that now causes a crisis. Now, we have known since 1930, Scriver and Wow, that the sickling of the red blood cell is not a one-step process. It's a two-step process, with the first part of the process being reversible, which means the sickling process, if the patient gets oxygen within the first 30 minutes, which is the golden half hour, which is my discovery,
Hmm.
you can reverse and stop a crisis immediately. And if you can take a pain from 10 to 0 with just oxygen alone. But what happens is that the present way people with sickle cell are treated is that they have to go to the hospital after the crisis has already started. By the time they reach the hospital, the sickling is irreversible. The cell membrane has been damaged to the extent where it no longer responds to oxygen. So look at oxygen as CPR for the red blood cell.
Hmm.
When they're struggling and about to die, you give them oxygen, they recover. But once they're dead, they obstruct the blood vessels, causing severe pain, loss of blood flow to the organs. And the only way the body has to deal with that is to destroy those damaged cells. And by destroying them, then the blood count drops. The person gets severe anemia, needs a blood transfusion. So it becomes one complication after another. So, but if you can stop it in those golden half hour, all that sequela goes away.
Wow, that is amazing, doctor. Like, oh, whoa, that is awesome. And I'm so excited to be a part of being able to have this conversation with you about it because I know, and it's so crazy too. Like, since we had our last conversation, I am more like into like understanding the sickle cell and sharing it with people and all these type of things. And I just think that it needs to be talked about more because it seems like it's one of those topics. I always say it's kind of like reminds me of medical equipment a little bit. No one really talks about it until they need it, right? And just to be able to get that information out is so critical. So as we look back, as you reflect on the past 2 years, what milestones or moments stand out to you?
Well, the milestones stand out like we have more doctors
Hmm.
implementing this discovery. We have a hematologist in Lagos, Nigeria. He's going to have a video presentation during a second anniversary conference, which will be on July 4th
Hmm.
at 9 a.m. Pacific time, 5 p.m. Nigerian time,
Okay.
12 noon East Coast time,
Hmm.
and talking about how providing his patients with home oxygen has significantly lowered his rate of hospitalization. They don't come to the hospital anymore.
Wow.
They stop their crisis right at home.
Whoa, that is so he will be showing a video and then talking about that on this 4th of July.
Yeah, yeah. He will be showing a video talking about his experience with
Hmm.
home oxygen. Then we also have several family members who have used home oxygen who are coming to talk about their experience with home oxygen. So those ones will also be talking.
Hmm.
And then I will present. the state of the discovery address, um, um, to show all the progress that has been made.
Mm-hmm.
And and yes, this is the first time in 7,300 years since the pre-dynastic period in Egypt, more than 3,200 years before Christ, that there's been any solution to prevent, reverse, and stop a sickle cell crisis. 7,300 years.
1,300 years. Why? What do you think? Why did it take so long?
Well, first of all, oxygen had to be discovered. Okay.
Mm-hmm.
All right. So that was done. Then, secondly, what misled medical science was that when they gave oxygen in the hospital, it didn't work. So they thought it doesn't work. They didn't realize it was the timing of the oxygen.
Yeah.
That by the time they were getting to the hospital, it was too late.
Oh.
So that was what misled them.
Mm-hmm.
And the pharmaceutical industry, we're always looking for a pill that will increase oxygen at the molecular level. Again, the key word is oxygen. They were trying to get the red blood cells to hold on to their oxygen a little bit so they don't get a low oxygen state that makes them sickle. And all well and good, but the real deal is the oxygen gas itself. So we have the pill hydroxyurea,
Mm-hmm.
which has been the mainstay for sickle cell disease. And how does that work? It increases the level of hemoglobin F, the fetal hemoglobin. Now, what does the fetal hemoglobin do? Fetal hemoglobin was designed by nature for the fetus to extract more oxygen from the low oxygen environment of the uterus. So the fetal hemoglobin has more oxygen affinity and keeps the oxygen. So hydroxyurea, incidentally, was found to increase fetal hemoglobin, which, by allowing the cell to hold on to oxygen, prevents it from sickling as, as much. But hydroxyurea only decreases crisis by about 50%, but it cannot stop a crisis that has started. Home oxygen can stop a crisis that has started. And in our initial study of 98 patients in Nigeria, it was able to decrease hospitalization and blood transfusions by 79 to 80%.
So when you talk about the medication that people take for it, is there something like any medication out there that people take that kind of help even avoid having the symptoms, or how does that work?
Well, the hydroxyurea
Mm-hmm.
helps to decrease the chronic hemolysis, the chronic destruction of the red blood cells, which happens because they get irreversibly sickled. Now, there have been several drug trials to bring new drugs like Oxbrita and Adagvio that have the same principles of Oxbrita, the same principle of molecular oxygen, Adagvio, the principle of decreasing the adherence of the red blood cell to the blood vessel wall. But they all failed because after passing phase one and phase two of the clinical trials,
Mm-hmm.
in phase three, they found out that patients with Adagvio and Oxbrita had more crises on the drugs than on placebo. So, which means the drugs were not very good in preventing crisis. They were good in increasing the hemoglobin, decreasing hemolysis, but they couldn't stop a crisis.
Mm,
Nothing can stop a crisis faster than a gas.
right.
Within 2 or 3 seconds, that gas is diffusing through the lungs, is in the blood vessels. Then the medicine that you have to take by mouth has to go through your GI tract, gets absorbed. So nothing comparable. And of course, home oxygen is accessible to everybody, affordable. There's no patent on it. Nobody's making $1 billion on it. And even those drugs that were given before they failed their trials, they were like costing $10,000 a month.
Whoa, 10,000 a month.
Yeah. Whereas you can get a concentrator now for $500 They can last you for 3 years.
Right. So the medication, so how much is the medication cost now? So let me ask you a question. So with the medication, do you take the medication and then you also have oxygen too, or you can't do both? How does that work?
Well, the medication prevents the chronic damage to the blood
Hmm.
cells,
Hmm.
but cannot stop a crisis. So
Okay.
there are some new medications that have been in trials. They're
Hmm.
called pyruvate kinase activators. And one of them was able to decrease the crisis by 27% and increase hemoglobin by 1 to 1.8 grams per DL. So, but they've not been approved. They're going to be submitted for approval
Hmm.
second half of this year. So
Okay.
if they're approved, they'll be used in combination with home oxygen.
Yeah, that's
Nothing replaces home oxygen. Nothing.
right, right. Because at that point, and I want the listeners to know, so basically, example we're saying here, you're saying, doctor, is like you can be taking the medication, but then if you still have a crisis, if you have that oxygen, it can help you with it getting worse or help you with that pain if it's taken at the right moment in time using that oxygen.
It can stop the crisis.
Stop the
It can
crisis.
stop the pain.
Okay.
It can prevent your hospitalization. It
Hmm.
can prevent every other thing.
That's amazing.
Yeah.
It was amazing. I saw some of your videos that you had did, and they were like amazing with families talking about how they were relieved and the pain went away, and that was, yeah, it was really like emotional too, because I was like, wow, like she was just, yeah, it was totally amazing. So I think you kind of touched on what the attendees or what they're expecting to be talking about on the program this 4th of July and
Yeah.
who should consider attending. So who do you think should be attending this call on the 4th of July on this anniversary?
Any person or family or caregiver of a person living with sickle cell disease
Mm-hmm.
should attend this. Any doctor who
Mm-hmm.
treats patients, primary care, hematologist, whatever specialty, should attend it.
Yeah, yeah. And so why was it important for you to make sure that you had a realm of different people? I think there's physicians, researchers, patients, caregivers, and families who's going to be on there talking about their experiences and things of that nature, or sharing their experiences. So that's why, is that one of the reasons why you wanted to have those people on there?
Well, yeah, so that everybody gives their own perspective
Yeah.
of what this discovery has done.
Mm-hmm.
Once again, we are living in a moment in time that for 7,300 years, nobody, they'd never had the benefit of. So we are making history right now.
Yeah, you are. Yeah. So that's because that's going to be really an interesting call to hear people talk about their experiences and then have the doctors talk about what they've used and how it's benefited and been a blessing to their patients. So yeah, I'm
Correct.
definitely excited to listen in myself.
Please do. We are, and all your listeners are welcome to tune in July 4th, 9 a.m. Pacific, 12 noon Eastern, 5 p.m. West African time.
So you guys heard that, and we would definitely have that listed too in the blog, so you guys can go on there and be able to get a hold to the link and things of that nature. So the next question for patients and caregivers: what message would you like to share with the individuals living with sickle cell disease, and what encouragement would you offer to family members and caregivers today, Doctor?
For the first time in human history, we can prevent, reverse, and stop a sickle cell crisis. A sickle cell crisis before used to be a one-way trip to the hospital. Not anymore.
Wow. What do you hope physicians and nurses and other healthcare professionals gain from participating?
Well, they gain to by getting the knowledge and sharing the knowledge with their patients and caregivers, helping them to get their life back. And I want to remind the audience, sickle cell disease is not just a medical problem, it's an economic problem. The economic impact from patients being in the hospital, caregivers being in the hospital, parents and families being there, mothers taking time off work,
Yeah.
fathers taking off time off work, is a significant economic impact, significant. And with this discovery, um, we can actually increase the GDP of Nigeria, Africa, and the US um, by decreasing hospitalizations and blood transfusions and all the other complications of sickle cell. In fact, in Nigeria, it's estimated that 4.8 to 7.2 billion dollars is lost annually through hospital admissions, emergency department visits, blood transfusions, organ complications, premature mortality, lost school attendance, lost workforce productivity, caregiver time.
Oh my goodness.
This represents roughly 2 to 3% of Nigeria's GDP. So, based on a prospective study of 98 patients where we showed home oxygen reducing hospitalization and blood transfusion by 80%. If the case series could be replicated at scale, the potential reduction in the sickle cell disease burden in Nigeria will be $2.5 to $4.5 billion a year.
Oh my God.
And in the United States, $1.5 to $3 billion a year.
Whoa. Repeat that, doctor. What did you just say? How many billions?
In the US, $1.5 to $3 billion a year.
Did you guys hear that? 1.5 billion. And what was the name and what was the number for Nigeria?
Nigeria was 2.5 to 4.5 billion dollars a year, because Nigeria is the epicenter of sickle cell in the world, with 4 to 5 million patients.
Wow. Billions of dollars.
Yes.
What I mean, like what when does it like become something that's talked about everywhere when you look at these type of numbers? Like what is the because you would think like, okay, we're spending it's a 1.5 billion in loss. Why isn't someone picking this up to say like, hey, we need to let this be it should be on TV, it should be everywhere.
Well, it slowly, I'm going to be presenting the findings of that study in the National Medical Association conference at the end of July. So it's slowly.
Okay.
It's like turning an aircraft carrier to a different direction.
Yeah.
The people are used to the same paradigm. The
Mm-hmm.
present paradigm is what I call the MAD paradigm,
Mm.
medicine after death. After the sickle cells have been damaged and died, then you start treating them in the hospital. Whereas we're trying to change that paradigm to a proactive, where the patient and their family are the first responders at home and not hopeless bystanders.
Right. Exactly.
So I encourage them. They can feel free to contact you. You sell medical equipment, you sell oxygen machines. They are free to get it from you, to get it from anybody else. And they can go on my website, sicklecelldiscovery.com, and read all about my work
Mm-hmm.
and see the testimonies of different patients and families.
That's awesome. Because my question was going to be, what are your hopes for the future of this initiative? But I think you kind of touched on it a little bit, you know. And so let me kind of go back to when you talked about you were doing a national presentation in July of this. That's this year, right?
This month.
This month. Oh my gosh. We are, today is the first.
Exactly.
Oh my God. I'm still stuck in June, you guys.
Yeah.
Yeah, so that's awesome. So you will be doing that presentation at
Yeah.
the end of this month.
Yes, I will be.
Okay, and so or will it be like publicized or how is that going to be working?
Well, that'll be at the conference.
Hmm.
So I don't know how it will be publicized, but I'm
Hmm.
sure there'll be some information.
Hmm.
But um, I'll be live on in July 4th with the Zoom meeting for the second anniversary.
Mhm.
So that'll be a very comprehensive way for people to log into the Zoom link and listen and hear.
All right. So outside of the event for the 4th of July, which is a huge event, I'm totally excited about it. And then of you doing your presentation at the end of this month, is there any other educational projects or any things that you want to share with the audience today that's
Well,
coming?
there are a couple cooking. I'm going to be in the Nigerian National Association of Nigerian Nurses conference in November in Connecticut, and I'm sure any conferences I will send them to you, Tara. You can post them on your blog so people can find out where
Awesome.
I'll be discussing this. And they are free also to join my WhatsApp platform
Hmm.
where I share information and respond to questions. And the link of the WhatsApp platform is on my website. I can also send a link to you, Tara.
Yeah.
And so people can join the Discovery Platform 3 now. We're on
Okay.
the third platform, but I share information on all the platforms.
Other platforms. Awesome. Well, you know what? So this is so exciting just to know because I think that, and I always say this too, even with the equipment that we provide, we do a lot of innovative, more of like smart beds and more things that kind of like move the needle, and that we've seen that's been a blessing for families outside of some of your basic of equipment. And I kind of feel like it's almost similar to that. Like when you know that there's other things out there that's going to be helpful for families, then we have to share it, right? So we've seen it real time make a difference for families and patients. And so we definitely excited to talk about this. And so again, you guys, it's going to be July 4th at 9 a.m. Doctor, I'm going to let you just say it one more time. Where
9
it's going to
a.m.
be.
Pacific, 12 noon Eastern, 5 p.m. West African.
West African. All right, you guys, and we'll be sharing the link it'll be a bio, a blog, and everything on our website. And we'll be sharing it. It'll be posted on social media clips and things of that nature. And of course, you'll be able to go and listen to this full episode on YouTube, Apple, and all of the places that you get your wonderful podcast from. So, Doctor, I just want to say thank you again, especially I know you're preparing for this call on Saturday. And I just want to thank you again for coming here on the Medical Equipment World and Healthcare Get the Scoop. And we will talk to you soon. And I think it's also, is it your birthday on the 4th too?
Yes, you can say that.
Yes, yes. So how awesome is that, Doctor? How awesome is that? So you guys, if you're going through out there and you have sickle cell, or families out there who may be dealing with sickle cell, definitely have them tune in, listen to this. I feel like knowledge is power. And so that's definitely we will want to share here today is knowledge, resources, and information. So thank you guys for tuning in. And Doctor, thank you again for spending your day with
Yeah,
us. 45
sure.
minutes.
Yeah. And thank you for all the work you're doing, Tara. And I also want to remind the audience it's America's 250th birthday,
Yes,
the 4th of July.
it is. It is. Yeah. So it's going to be a lot of celebration going on, you guys.
God bless America and God bless the sickle cell discovery.
Yes, God bless. God bless America. All right, you guys. You guys heard it here on the CFS Medical Supplies and Equipment. Actually, it's sponsored by CFS Medical Supplies and Equipment, CFS Solutions. And you heard it today, this conversation about sickle cell and all this wonderful discovery with Dr. Sota on the medical equipment world and healthcare. Get the scoop.